Welcome to Brandstorm, the podcast that talks to the people behind America's brands. I'm Dan Trasinski, president of Platypus Advertising and Design.
And I'm Nancy Christopher, PR director at Platypus. Our guest today is a healthcare evangelist, an international healthcare industry expert. She pioneered the planning of the first network of freestanding breast health centers in the greater Pittsburgh area and the establishment of more than 75 model women's health education and primary care clinics around the world. Please welcome Tanya Abreu, a healthcare marketing innovator and successful speaker, author, and workshop leader. Thanks for joining us, Tanya.
Thank you. After that introduction, I feel like I should have a walker.
No, you're just an overachiever at a very young age.
That is true, and it's been a wonderful journey, and I always love to hear the perspective on it, and I appreciate being here. What an exciting opportunity to share some perspective on healthcare branding.
Well, Tanya, you've had a remarkable career, so tell us a little bit more about you.
I started out in education. I was a university professor. I taught business communications at Carnegie Mellon University in their Graduate School of Industrial Management. When I then took a gig, if you will, under Glasnost and Gorbachev, and I went to Russia to teach American English at Moscow State University. To make a long story short, I got excited about being able to change healthcare in the former Soviet Union from a state of terrifying technology and lack thereof to something that was much more humane. I came back to the U.S. and I partnered with Magee-Womens Hospital, and the rest is history. I became really involved about the transformation of human health through branding and outreach.
So you're obviously an innovator in women's health. What led to the establishment of the freestanding breast health centers in Pittsburgh?
Because women didn't want to come to the inner city to get a breast image. It was frightening, not the inner city as much as the whole idea of going into a hospital and trying not to think you might have cancer. And so under the very innovative leadership of Irma Gertzen, who was the CEO at the time, she said, look, we're not a hospital. We are caring about women. So let's set up centers close to where they live. Now, we know this exists everywhere right now.
Exactly.
But at that time, this was unheard of. And so we spent millions of dollars on women and opening freestanding breast centers that then began to include all other types of women's health, from pelvic health to heart disease prevention. Very exciting, and I was so proud to be a part of that almost 30 years ago now.
I was going to ask you, what era was that?
That was the late 80s, early 90s.
Okay.
And then this was, of course, pioneering is the word you used. And it truly was very exciting. And, at that point, Magee had been known as the baby factory, if you will, 10, 12, 13,000 births a year. But the other smaller community hospitals had more of the cancer volumes or more of the general surgery. And we were a women's hospital, and we didn't understand that. And by the time we were done branding something called Woman Care, which took the fear out of healthcare, we had 80% of the population of women loyal and utilizing us.
Wow. So what is your perspective on women in healthcare?
Well, I believe very strongly in this. Women don't like disease. I don't think anybody does.
I was going to say, I suspect Dan and Cal here don't like disease either.
Well, it depends on the disease.
But I will tell you, honestly, in research and in 35 years of experience, men prefer to know that they have a diagnosis that they can treat. And they're not as afraid of their lives stopping for it. Men are just more action-driven. Tell me what I got and tell me what I have to do. Where I think women say, look, you can't tell me what I have because I have 2 young children, a mom I care for, a husband who needs some extra help right now. And we have a way of shunning even wellness care because it takes too much time. And the fear that's implied is that it's going to stop our lives from going forward. I'll never forget, Nancy, a focus group that I had of women who had breast cancer in either a mother or a sister, and they had not had their first mammograms. And overwhelmingly, they all said, it's not the fear of the disease. It's the fear that we're going to have it right now and we have to stop our lives. Would rather have it 10 years from now.
That's weird. Yeah.
Yeah, but I have to agree with you, Tanya, because, most men I do know, and I'm going to give the example of my brother, whenever the doctor tells him what's wrong with him and what he has to do to change it, boy, he is Johnny on the spot and he does everything right. And it's really difficult for me to do that.
It really is. I know as Brandstorm and trying to really understand and help healthcare organizations and hospitals, and after Magee, I worked with over 250 hospitals with my own company, Spirit of Women, and now with Women's Choice Awards and the Lipstick Alliance of U.S. Hospitals. I go into the C-suite and help hospitals reevaluate how they're presenting health to women, because we know that women make upwards and more of 85% of all healthcare decisions for their families, for their extended families. And so in order for a hospital or even a healthcare company to grow its brand, you need to speak not just to the market and to the mind of women, but it's a unique proposition capturing the heart share of women. So my 30 plus years, and I'm dwelling on that because it's my birthday today.
And happy birthday, by the way.
Thank you. But it's all about helping businesses understand that you have to capture the heart share of women before you capture their dollars. And if you don't get that, like other industries do, you're not going to be rich.
So let's put some perspective on that. I love that heart share term, but what do you think is the biggest mistakes hospitals or healthcare providers make in branding?
To women, that we have a doctor or a machine or a group of nurses or a history that can fix you.
I guess I expect that, though, when I go to a hospital.
Right, but women don't like to be fixed. We like to be encouraged and we like to be improved. And so the average woman, when she is making a decision about a hospital or a doctor or even a healthcare brand, she makes a decision based on experience first. Even when we're talking about outcomes for something like cancer, which I personally underwent, yes, I want to know what the doctor's success rate is. And yes, I want to know what the hospital's success rate is if it's available. But I also want to know about the experience and the quality of life that other patients underwent. So it's always really important for a hospital or a brand to make sure they have credibility established from testimonials, other patients, word of mouth, grassroots in marketing healthcare to women is paramount. It's more important than the full page ad. It's more important than the billboards. I mean, I went to Dallas a few years ago, and on one of the main highways, there were 4 billboards. I took pictures of them, all saying that they had the best heart programs in the city. I don't know how that's possible. So as women, we need something more personalized. We need something that really speaks truth to us personally.
So do you know of any healthcare facilities that are going to more of those softer touches? Like maybe you talk about if you do have cancer, I mean, here's the support groups that we would have or the child care that we might be able to help while you're getting encouraged, improved, and not fixed. I don't want to say the word fixed, but...
Yeah, I do, as a matter of fact. And those are the hospitals that retain us and I work with. I don't know if you followed the work of Kindred Health lately, but they have done amazing things with their brand around kindness in healthcare and with their community events and their social media, which in today's day and age has to be a whole wraparound, has to be there with the advertising as well as with the daily chit chat that occurs in the halls of a hospital or at a community events or in women's groups throughout the community. So there are lots of hospitals that have begun to look at marketing as what I would call patient experience communication or community communications. If I had my way right now in healthcare, there'd be 2 things a hospital would have to do: advertising and community communications. Marketing, I wouldn't even use that language anymore. You're not selling anything to women. You can't market currently health to women in ways that work. You have to do things differently.
You had mentioned you had cancer.
Mm-hmm.
And of course, you've been in this business for 3 decades. How much has that shaped your opinion now about how healthcare should be? Or has it been an extension of what you knew 30 years ago?
Sometimes you know things, but until you live it, it's
Right.
bogus, right? So I always knew that hospitals that encourage women, support women, will make them more loyal and they will generate more revenues. But until I went through the process of finding a facility that would encourage me instead of control me, that would give me hope instead of more medication, until I could find that, I realized that so much of it was just lip service to what we thought women wanted to hear. Right now, I've started a group of hospitals. We call ourselves the Lipstick Alliance of U.S. hospitals. It is hospitals that are joining. This is so beautiful.
It is.
83% of women use lipstick every day, guys. 83%, some kind of lip product. What if we could get women, every time they put on their lip gloss or chapstick or lipstick, think of, what am I going to do healthy for myself today? What can I do to improve my health today? And so I'm getting a group of hospitals together that want to make this a movement, want to make this something that women will recognize, like they have the red dress or the pink ribbon. They will have this lipstick icon, which is wellness every day for women. That's what I believe hospitals need to get behind. How can you get into the homes of women? How can you get into the gyms where they work out, the parks where they walk, the daycare centers where they trust their children? That's the future of, I'm going to say, marketing to women, but building communities.
So we often at Platypus say a brand is the promise of an experience. So, and you keep using the word patient experience. What do you think patient experience should be when you visit a healthcare provider or healthcare facility that is maybe out of the box or out of the norm of what, my expectations are pretty low when I go to when I go
That's because you're a man, dear.
right, but it's like, okay, I know I'm going to wait and then I'm going to see a doc for 5 minutes and he's going to move me through and stuff like that. What can healthcare providers do to break that mold? Because it's the time is money thing, right?
Yeah, it's two things, and both you can do swiftly. You just need to have what I would call the template in place, or the script in place. It's making sure a woman feels like she has been heard. She just hasn't filled out a bunch of paperwork and nobody's read it. So, number one, she feels that she's been heard. And two, she leaves feeling encouraged. She leaves, no matter if she has fourth stage cancer, she leaves feeling more encouraged than when she came in. And so those two things to me are pivotal in healthcare branding. One, feeling encouraged. Two, feeling that you were listened to. And how you can put that into place as a brand can be as mechanized or as personalized as you want. But unless you learn how to do that, you are not going to beat your competitors. It needs to be a positive experience. We're all aware, and I love this statistic, that heart disease is the leading killer of women. But yet, if I interview 5 women, only one of them in their 50s has had a baseline heart evaluation. They have had their mammograms, but they've not had their heart evaluated with an echocardiogram. Why? Because we know about it and because we fear the results. However, if you can encourage women and if you can provide positive consumer experiences, those can be online fun events, they can be good reminders, they could be incentives to come to a heart day at a hospital that is painless. You just get it done and you get a lipstick. Give lipsticks out if a woman gets her heart evaluated.
I really love that Lipstick Alliance idea. That is fabulous.
It is, and it's fun, and and I'm saying brilliant, not patting myself on the back,
It's
but
pretty
it's
brilliant.
brilliant. Because women view lipstick as a way to not attract men, but to make themselves feel better, to give themselves a pop of color on a day that feels drab or tired. And that's healthcare, Nancy. What do you do that makes you feel a little better every day? And if you can make a woman feel a little better, no matter what her diagnosis is or no matter what she's facing, you know what? You're going to make her take action, walk through your door, do something with you.
One thing we need to adjust, though, that really bothers me about healthcare is the cost efficiencies and how expensive it is nowadays. I seriously think about when and if I'm going to the doctor based on, do I really need to spend this money right now? It's tough.
Yeah, exactly. And even, it's funny, my copay is $100 for a specialist, right?
Right,
And if you have kids that are in need of even their school pictures, you think, okay, I can put that off a month, right?
right.
But here's what I think we're moving to in our country, and it's important. You've heard of the new CMS payment to doctors, and it's real. 1 in 4 doctors now will be accepting a capitation. We tried to do this in the 80s and 90s, but hospitals wouldn't play in that game. There's going to be no choice very soon. Now, how it's working is physicians will say, look, I'll take X amount of dollars, let's say $5,000 a year on a patient. And for that, I'm going to keep them out of the hospital as much as I can. But if they end up in the hospital, you're going to ding me. I'm not going to get my $5,000. Or if their diabetes is not under control by blood tests, you're going to ding me. So the physician practice is really incentivized to be a wellness practice. What does that mean? Make sure you send out education in a fun way to your patients every week. Make sure when they come in, you have a nurse educator really spend time with them in a constructive, not critical way to help them lose weight, to help them get their numbers under control, to help them reduce stress. It's really important. But here's the key. Hospitals are going to need to be doing this soon. It's too expensive otherwise to function as acute care facilities. So it's going to be an interesting world where hospitals and physicians are going to be looking to healthcare marketing companies, other healthcare brands to help them manage populations of people so that they don't get sick.
I'm seeing that more and more in some of the healthcare providers we work with where, things like concierge medicine or telemedicine, more wellness care is coming into vogue where, hey, you have the sinus infection, you need to think, I don't need to make the appointment. I can fill out some information online. I can have NP or PA diagnose me based on similar symptoms and send me my prescription.
And that's fine as long as there's a relationship established that is real time. I love telemedicine. I'm a big proponent of it. But as a part, remember earlier I talked about surround sound, right? As a part of a total wellness experience for a woman and her family. So yes, that is a money-saving modality. And heck, people even deliver the drugs now for free.
Right.
But it's really the longer goal of keeping people's immune system healthy, keeping them un-sinus infectioned.
Right.
That's important. And the government will reward hospitals for keeping our Medicare population out of the hospital.
Yeah, that has been a shift where they're being rated and their reimbursements are about keeping people out of the hospital now versus in.
I think there's a real risk with telemedicine to be very impersonal.
And incorrect sometimes.
Correct.
Yeah, because we don't tell people everything that's wrong with us. We don't give a systemic background of what we could possibly be dealing with.
So don't we risk missing things more?
Well, my opinion, telemedicine needs to be a part of a wellness practice where there are records. Your blood tests are online so that a physician or an NP that is prescribing or talking to you really gets a sense of who you are. And, therefore I love the electronic medical record concept where your blood tests, and blood tests are the primary indicator of wellness and disease, are there for everyone to see, and as well as your diagnostic tests.
We're actually working on one right now. The people that are doing telemedicine right, they're encouraging you to build that medical records profile when you're well. So they do know you and there is a relationship built. So those records are there. So when you do get a bee sting, a sniffle, a pink eye, or whatever it happens to be, they already know a lot about you.
For me, the risk at something like telemedicine is if you're cut significantly, not enough to get stitches, but enough to want to talk to a doctor, and you don't tell that doctor that you have diabetes, and they simply say, get some antibiotic cream and, call me back. You're missing the fact that diabetics have compromised immune systems and they can get, very serious infections very quickly. So I really think there has to be a comprehensive medical record attached to telemedicine.
Well, let's switch gears a little bit. Your new role right now is National Director for Women's Choice Awards. What is that about?
Well, I have taken on a wonderful responsibility. Women's Choice Awards is an award that is third party verified, 100% objective, that acknowledges hospitals for their quality measures in patient experience, in orthopedics, and service lines. But it is done with an overlay of what is important to women. Once again, my life's work. So every hospital that carries the Women's Choice Award seal has been approved by women and has the standards, objective standards of quality and HCAHPS for patient satisfaction. As a part of my role there, though, however, I am generating this new network of hospitals that are focused on wellness, focused on keeping women out of hospitals unless they really need it, on helping women understand what diagnostics are important and how not to fear healthcare. And so that's the Lipstick Alliance of U.S. Hospitals. That's also a part of my Women's Choice Award responsibilities.
So how would a healthcare provider or hospital apply for this?
Thanks, Dan, for asking. It is market exclusive because it's a national movement, but we want only one hospital per market so that we can get outstanding case studies on how this helps a hospital build revenues. So they are free to call me. I have a direct business phone, and that's 561-358-5230. But there's not per se an application process, but there is an agreement to use our 1412 strategy, which are templates and education and content, a national awards program in order to build relationships with women that achieve new business. That's the essence.
Is there a fee to be involved in that?
Yes,
Okay.
there is a fee. Right now, it's being reduced for the first 20 hospitals, but it comes out to, less than $3,000 a month. It really is amazing amounts of learning best practices from other hospitals, having all of your content delivered, working with advertising agencies if a hospital has one to integrate this into the brand. And it also comes with relationships with sponsors. Dr. Hauschka that gives wonderful pink lipsticks for breast cancer, red lipsticks for heart disease, to really make the program sizzle, give it color in the community.
How are you reaching out to all these hospitals to let them know about the Lipstick Alliance?
Well, it's very subtle right now because we want our first 5 hospitals to be really operating and showing quick ROI. But we're doing it through email, through mailing, and soon we will be at healthcare conferences around the country talking about what it is and the early results from our hospitals.
That sounds like
Excellent.
a great program.
It really does. I'm really excited for you, Tanya, and I hope everything goes well. And you should keep in touch with us and let us know how it's going.
Oh, I absolutely will. I really am intrigued by Platypus and looked online, and I had not heard of your agency, but the work you do is heart share work. It's creative, it's mind and heart and market share. Good stuff.
Well, thank you. I appreciate
No,
that.
I was impressed, honestly.
And other than the phone number you gave, is there other ways that people should connect with
Email, LinkedIn.
Yeah, well, I'm absolutely on LinkedIn, Tanya Abreu. My email is also, I think, there on LinkedIn. I'd love for people to look at womenschoiceaward.com as well as the Lipstick Alliance on Facebook. And yeah, certainly the easiest way to reach out to me besides my cell is LinkedIn. InMail on LinkedIn is where I go at least 3 times a day to talk to people.
I agree with you. And having said that, I'm just going to suggest that if you have any questions for Dan and me about today's episode, please feel free to contact us on our LinkedIn pages. Thanks for your support. If you like what you've heard today, please don't forget to share, review, and subscribe to Brandstorm.
This is Dan Trzynski along with Nancy Christopher at Platypus Advertising and Design, an awesome company that creates perceptions that influence choice. We hope you'll join us next week for another episode of Brandstorm.